latest update we are getting you right now comes in from National Capital, where yet another person has tested positive for monkeypox. He also happens to be a Nigerian man residing in Delhi who has tested positive for the virus, which makes him the third case of this disease in the National Capital. The second incident had been reported yesterday. Sharon now tells us more about this particular patient. Sharon.
This is in fact another Nigerian nationalist who was in fact living in Delhi, who has tested positive for monkeypox. And in Delhi, from Delhi itself, this is in fact the third case that is being reported. Overall, now the tally of the monkeypox in India stands at 9, out of which 5, in fact 6 has a history of international travel. Now, keeping in mind that how starting from 14th of July, the number of monkeypox cases are increasing. There is a number of guidelines that has in fact been implemented. Strict screening of passengers from international and domestic is happening, and also the awareness of the patients, and also whoever has come in contact with the patient is being asked to isolate. Now, in this case, the contact of this infected person has been asked to be isolated for next 2 weeks, and he's being monitored is what the health ministry has been telling us.
Right. Does this particular person have any link to the patient number 2 from National Capital who was also a Nigerian?
Well, those details are not something that is being put out by the hospital authorities. We have to wait for such details.
Okay, Sharon, do stay on with us, because we're now joined on the broadcast by Dr. Sanjeev Bagai. Sir, yesterday India has set up a task force now, given that first death was confirmed from monkeypox day before yesterday in Kerala. How do you see the situation panning out for the country now?
I think we need a high index of suspicion, a very, very strong public awareness message. The do's and don'ts, not only for the social community at large, but also for the medical professionals, because a lot of the younger lot of doctors would not have seen so much of pox, very rare group of infections in their clinical practice. But the message for the community is to take precautions. This is transmitted with a long incubation period lasting almost up to 21 days, with fever, pustule, rash, crust, lot of eye involvement, ophthalmic involvement, sometimes with neuromuscular disorders, CNS involvement, brain involvement. So I think we need to be careful. Masks are important because it is a droplet infection as far as airborne is concerned. It is sexually transmitted. It can cross the placenta from a pregnant lady to a fetus. And more importantly, through direct contact, in case the person is infected, the person has a high chance of infecting people who they come in close contact with. So I think we need no panic. We need to inform the public that in case there are any symptoms, to quickly isolate yourself, wear a mask. Mask is extremely important still, and to bring it to the attention of the local medical doctor. This is generally a self-limiting disease. If it is treated in an appropriate manner, the real risks are for the people who have high levels of comorbidities, or in case they've of course not been vaccinated with the smallpox vaccine, which was stopped in 1978 to 1980.
Right. Mr. Bagai, there is also another matter of concern. Now, Kerala Health Minister, when she spoke about the person who died of this virus, said that he did not have typical symptoms of monkeypox, which is why they've also set up a probe. What really does that mean? What are typical symptoms? And like what happened with COVID, what if there are people who suffer from this virus but do not have swelling in their lymph nodes, etc.?
Yeah, so the quick differentiation features between monkeypox and the other mimicking viral infections like chickenpox and other pox group of infections are that this rash comes almost simultaneously and spontaneously. So it does not come in crops or waves. The second important point is that generally there is a high level, almost a 70-80% involvement of cervical and neck lymph nodes being enlarged and tender. Very high involvement of eyes and the mucous membranes. But having said that, the typical symptoms are fever, followed by a rash, which can be normally maculopapular, means just a little raised nodule. Then it can turn into a pustule, which has pus, and then into a vesicle, which is oozing, and then crusting. It is important to note that even the crusts are infectious. So the crusts, even if they fall off and the lesions are healing in the skin, the crusts are infectious. Look out for mucous membrane, eyes. Look out for a full clinical examination. That would be a key.
Right.